Hi everyone, I'm Dr. Joey Adashek. I'm president of the Nevada State Medical Association. I'm also a high-risk pregnancy specialist. I want to talk to you today about prior authorizations because the bane of our existence, as well as most of our patients, is prior authorizations. The problem is this: every time that we want to perform a surgery or procedure on a patient, we need to ask permission from their insurance company if we are allowed to do the surgery or to do the procedure. And of course, these aren't physicians. This is just the insurance company sort of practicing medicine without a license. And they are saying, oh, yes, you could do it, and no, you can't do it. And if they say, no, you can't do it, which they do a lot, then we have to fight it, and that's a whole other problem. But I want to talk about what happens when they do approve it. So when they approve a surgery you can do, and then you as the physician go ahead and do it, and say the patient does well, goes home, everyone's happy, the insurance company can still decide that they don't have to pay you. And they always say prior authorization is not a guarantee of payment. And then, of course, us doctors will say, well, then what's the whole function of it? Is if you say it's approved and you do it, and they say, yeah, we don't have to cover that. What other business does this type of thing? So one huge problem is this bill that's going for the legislature now is going to fix that. It's going to fix the problem of insurance companies saying, oh, we approve you to do this surgery. You do the surgery, the patient does well. Now they have to cover it. And the other thing the insurance companies have been doing is they will end up paying for the surgery that you do, so the patient doesn't have to pay, the doctor gets paid, everybody's happy. They could decide 6 months down the road, oh, wait, there was a mistake with the paperwork, something like that. We want our money back. What kind of business is that? So, of course, we might say, the patient did well, we did this surgery, we're not going to give you the money back. And they say, that's just fine, because we'll just take it off of payment from the other patient that you did the surgery on. And now it doesn't matter if you pay us back or not, because we took it from someone else. And this process needs to be fixed. So there is a bill going before the legislature. It's AB463. Please just Google AB463 Nevada legislature, and you can find times where you can testify, you can tell your study all the times that it was denied or took forever to give authorization for surgery. So we will talk way more about prior authorizations, as there's so much more to this bill. But thank you so much. Take care. Bye-bye.